Welcome, everyone. This is a closer look at the 34 FDA authorized e-cigarettes. This is where I work at the Public Health Law Center with a great team of lawyers, policy analysts, and administrative staff. A lot of us at the Public Health Law Center work in commercial tobacco regulation and control, but we also have thriving divisions in healthy eating, active living, climate justice, and I'm really excited to say that we have a brand new team supporting public health infrastructure. Prior to coming to the Public Health Law Center, I was a litigator for 20 years, 10 years at the Minnesota Attorney General's office, and 10 years in private practice. I'm also an adjunct professor at Mitchell-Hamlin, where I teach advanced trial skills and business practicum. Somewhere during the COVID-19 pandemic, I made a career shift into public health law, which is what brings me here today. The Public Health Law Center is located at Mitchell-Hamlin School of Law in St. Paul. For over 20 years, the center helps local, state, national, tribal, and global leaders promote health by strengthening public policies. What drew me to this work here at the Public Health Law Center is we use our legal knowledge to seek justice for public health. We support our partners to reduce health disparities, and we try to bridge the gap between our public health partners, whether that be researchers like many of you, advocates, or governmental entities, and the law. Our goal is policy that will improve public health through sound legal policies. And that means centering the social determinants of health and equity in all of our work. We do that by offering free legal technical assistance. What does that mean? It means we do legal research, policy development, publications, trainings like this. We don't lobby, and we don't provide direct representation. Although we do provide litigation support, such as filing amicus briefs, citizen petitions, filing comments with federal agencies like the FDA, and we track relevant litigation that impacts our work. And we try to disseminate that information in an understandable, usable way. Now let's get to work. I reviewed the list of attendees today. It's a really sophisticated commercial tobacco crowd. We have almost 350 people that are joining us. And I shouldn't be surprised by the sophistication of the people here, given the dry title of the webinar. I didn't think that we were going to attract many people outside of the commercial tobacco control world. So I will breeze through some of the preliminary context to level set. And then I'm going to dive into the burning questions, which apparently many of us are thinking about. For starters, words matter, definitions matter, and we've got some loaded terms here. We have words that are written into the law, peppered with the industry narrative, which has been found in a way into common everyday consumer language. Then, of course, we also have public health vernacular. So it's important when we talk about these concepts that we're on the same page. But first, a little history and a little law. In 2009, Congress passed the Family Smoking Prevention and Tobacco Control Act. You all know this. And where I work, we call it the TCA for short. As a reminder, this law banned characterizing flavors like candy, fruit, and alcohol in cigarettes, which is why you don't see flavored Marlboros or Camel Lights. However, as you also know, due to heavy tobacco industry lobbying, the law included two big exceptions. The law exempted tobacco and menthol flavors, and it didn't cover e-cigarettes or other non-cigarette tobacco products. And here I'm going to introduce a term if you don't already know it, and if you do, it's good review. What are e-cigarettes? This is taken from the FDA's website. Vapes, vaporizers, vape pens, hookah pipes, electronic cigarettes, e-cigarettes or e-cigars, e-pipes are some of the many tobacco product terms used to describe electronic nicotine delivery systems, or ENDS. Also from the FDA's website, these products use an e-liquid that usually contains nicotine derived from tobacco, as well as flavorings, vegetable glycerin, and other ingredients. The liquid is heated to create an aerosol that's inhaled. Ends may be manufactured to look like conventional combusted cigarettes, cigars, or pipes. Some resemble pens or USB flash drives. Larger devices, such as tank systems or mods, bear little or no resemblance to cigarettes. These products may have reusable parts, or they may be disposable and only used once before they're thrown away. Okay, so these are the products that we're talking about today. So other than the two gaping exceptions, the size of a garage door, that is menthol, and e-cigarettes or ends, what else did the Tobacco Control Act say? The law said that no new tobacco products should be sold without marketing authorization from the FDA. This means that all e-cigarettes, which were not sold before February 2007, which is essentially all of them, must go through the pre-market review process to be marketed in the United States. In other words, the pre-market review process placed the FDA in the role of gatekeeper of new products that could be marketed. Products are not supposed to be on the market unless they show that they can meet the Tobacco Control Act's public health standard, meaning their marketing is appropriate for the protection of the public health. This is one of those terms that we need to pause and take a moment to define. And so for those of you who are new to this term, we'll go through it closely. And if you think you're an expert on this, think again, because the last term of the Supreme Court of the United States in a case called Loper-Bright versus Raimondo, the Supreme Court made a power grab on federal agencies and their abilities to interpret ambiguous language in overruling 40 years of precedents that was known as the Chevron Doctrine. So this is where things get interesting. Well, not if you're a researcher, then this thing is downright annoying. But I'm going to ask you all to play lawyer with me, or maybe even a Supreme Court justice, for a few moments while we all read the specific language of the public health standard given to us by the Tobacco Control Act. So this is what it says in the TCA. The protection of the public health shall be determined with respect to the risks and benefits to the population as a whole, including users and non-users of the tobacco product, and taking into account the increased or decreased likelihood that existing users of tobacco products will stop using such products, and the likelihood that those who do not use tobacco products will start using such products. What does that mean? Well, one can conclude that appropriate for the protection of public health means that the product in some way does not increase the risk to the population of a whole. That's the appropriation for the protection of the public health. That's a pretty low bar, isn't it? I mean, we already knew that cigarettes, a product that even when used as intended is deadly. So the language here seems to say that so long as it's not that, it means the definition of appropriate for the protection of the public health. So you're all working in commercial tobacco control, and I'm sure you get this question a lot. Well, aren't e-cigarettes healthier? Healthier? Which leads me to a fantastic question that one of our viewers asked in advance when she registered. What is harm reduction anyway? She said, if there's no baseline for nicotine, how can harm reduction product be determined? Well, it depends who's asking and about what. Harm reduction refers to a range of intentional practices and public health policies designed to lessen the negative consequences associated with various human behaviors, both legal and illegal. Note that here's an example of some harm reduction campaigns, and note that an important part of harm reduction tends to be evidence-based education campaigns. So harm reduction as it pertains to addiction. What does it say? And what does it look like in practice? So here's a definition from Johns Hopkins Bloomberg School of Public Health. Harm reduction is defined as acknowledging that drugs are widely available in our society. It encompasses the understanding that traditional law enforcement approaches, or those that require complete abstinence, do not decrease demand, use, or negative health consequences of substance use. So what does that look like in practice? Harm reduction often includes these sort of tools. We have like free syringe, overdose prevention sites, fentanyl sites, sterile injection or smoking equipment, Narcan kits, methadone treatments. Those would be some examples of some of our best known harm reduction tools. But harm reduction also comprises addiction facilities, support groups, and medical services, including wound care, vaccinations, COVID-19 masks, sex education, STI testing and treatment, condoms, pre-exposure prevention techniques, and other critical harm reduction tools and services. Achieving the goals of harm reduction depends on accessibility of these resources. So how do we receive these resources? And they list groups, places to get this: community clinics, health departments, churches, public transportation hubs, food banks, homeless shelters, for example. I'm not seeing smoke shop on this list. It's helpful for anyone. If it's helpful for you to think about it, this is how Public Health Law Center has been thinking about harm reduction. First, the FDA has existing product review pathways to evaluate and regulate the full range of nicotine products, from cessation or treatment products to combustion products. Second, a meaningful comparison requires evidence of harm versus evidence of benefit. So far, the commercial tobacco harm reduction debate has mostly been focused on harm versus the possibility of benefit. And third, the precautionary principle should govern regulatory decisions. When addiction and initiating a new addiction is at play, it mandates even more caution. In other words, the precautionary principle requires us to advocate for preventative action in the face of uncertainty to avoid harm to health. That's kind of a Minnesota nice way to say the precautionary principle should stand in the way of a mega corporation that's about to make a killing from harmful products. So now, where were we? Words, more words. Under the Tobacco Control Act, the term authorized and approved have distinct meanings when it comes to tobacco and nicotine products. In summary, authorized refers to tobacco products that have been reviewed and allowed to be marketed under the PMTA process. Approved refers to products that have undergone the FDA's drug approval process to ensure safety and efficacy, typically for smoking cessation or treatment, such as nicotine replacement therapies, like nicotine gums, patches, or lozenges. Here's a picture that represents some of the FDA-approved cessation products. As I understand it, the tobacco industry misuses the term harm reduction as a front for its goal of growing its market of nicotine products. E-cigarettes are not FDA-approved products. It may be, we don't know for certain, that switching to them completely can in some sense be a harm reduction strategy for an individual user, in as much as they contain less carcinogens than combustible cigarettes. On the other hand, most people don't tend to switch to them completely. And growing data shows that dual use actually increases the overall harms. In addition, e-cigarettes can hook new users, especially young people. So even if some people switch entirely to e-cigarettes, it's still possible that e-cigarette increases overall harm. So, as you know, unauthorized e-cigarettes have flooded the market in every flavor, shape, and design imaginable, just as combustible cigarettes use had dramatically declined over the past 20 years. And that was not the case for e-cigarettes until just recently. In September 2024, the FDA and CDC released data from the 2024 National Youth Tobacco Survey on e-cigarette and nicotine pouch use among youth. There was a drop in US middle school and high schoolers who used e-cigarettes in the past 30 days. There was a slight uptick in youth nicotine pouch use, which leads me to the next question from one of our participants. She asked, is there data and strategies for combating myths about nicotine pouches viewed as much less harmful because there's no impact on the lungs? And the answer is yes. Nicotine pouches are smokeless, tobacco-free products that contain nicotine derived from tobacco, along with flavorings and other ingredients. They're placed between the gum and the lip, allowing nicotine to be absorbed through the oral skin and mucus. Like other nicotine products, pouches lead to nicotine addiction. The addictive potential is a significant concern, especially among young users. And there is potential for oral health issues such as gum disease. Nicotine can have systemic effects, including increased heart rate and blood pressure, which can pose risks for cardiovascular health. And there is a concern about the appeal of nicotine pouches to non-smokers and young people, although more research needs to be done. Oral nicotine pouches from brands like Zyn and On, which contain nicotine powder in various concentration and feature youth-appealing flavors, have spiked in popularity over the last several years, with unit sales increasing sixfold between 2019 and 2022. And as already said, nicotine in any form is addictive and harmful to developing brains. Using nicotine pouches and other tobacco products concurrently increases the risk of nicotine addiction and dependence. These risks, combined with the rising popularity of nicotine pouches, highlight the need for more research and attention focused on how young people are using these products. So that's a little bit about unauthorized products. Now let's get into the meat of why you're here today. Here is the list of 34 products. Sorry, the writing is so small. I just wanted to capture for you in one page the list. The list is easily accessible on the FDA's website, but here I wanted to also give a special shout out to my colleague at the Public Health Law Center, Luke Hawk. In preparation for today's webinar, he searched for each of these products on the internet and we talked about them. The products highlighted in orange are products that he found photos of, either on the manufacturer's website or through Stan Glance's blog and other blogs. Highlighted are products with images I'm about to show you, and some of them include a 1 or a 2, suggesting 2 versions of the device, such as Logic Pro Capsule Tank System 1 and Logic Pro Capsule Tank System 2. He wasn't able to find 2 versions of the devices in those instances, and the products that are not highlighted didn't readily appear in a quick internet search. And we're not exactly sure why. We can speculate that either they're not really being marketed or that their marketing name is different, perhaps than what was authorized by the FDA. And this might be one example for why e-registry bills aren't necessarily great public health policy. When you look at this list, you can see that maybe it's not so simple to just distribute a list to a retailer and expect them to understand how that compares to the products on their shelves. So let's talk about the list. What do we see? They are from 3 companies: Logitech Technology, Enjoy, and RJ Reynolds Vapor Company. Here is the list from Logic Technology Development LLC. And I'm going to go through some of the photographs. This was one of the very first ones authorized. One of our first e-cigarettes with a capsule, a cartridge, and a battery. And this is the Logic Pro Capsule Tank System. Okay, those are a couple of the Logic techs. The Logic ones. Here's Enjoy LLC. This is the list of authorized products. You can see also the nicotine content. And so each one of those that has a different nicotine content is authorized differently, with the lowest one being at the Enjoy Ace Pod Classic Tobacco, 2.4%, and the highest being the Enjoy Ace Pod Menthol and the Rich Tobacco at 5%. Oh, sorry, no, Enjoy Daily Extra Menthol at 6%, and also the Rich Tobacco at 6%. And I'm going to just breeze through a bunch of slides here so that you can see the product, what it looks like. This is the Rich Tobacco and Menthol. Those are the 6%ers. There's the power unit. Here's a package of power units. This is separately authorized. And now we are to the RJR Vapor Company products. They have 16 products ranging from 1.5% to 5%. And there's an example of what some of those Views products looks like. So ending with those examples. So we've got 8 Logitech plus 10 Enjoy plus 16 RJR Vapor Companies. That equals 34. Those are your 34 FDA authorized ENDS products. A question from the participant was, has the FDA set a limit on the nicotine concentration in products that they approve? No, the FDA has not set a specific limit on nicotine concentration for approved nicotine pouch products. The next part of that question was, can this be inferred based on the authorized products? And I'll say that while an exact limit can't be inferred, we can look at the nicotine content of authorized products for insights into what the FDA considers acceptable, and we saw those at 1.5 to 6%. And then finally, the question was, how does the nicotine level in authorized products compare to other products on the market? I'll say they're quite a bit lower. And one thing that's difficult to compare is how the nicotine content compares. So these are some Loon products, which is based here in Minnesota. And here they're talking about these in milligrams. And they are talking about them in the context of puffs, but their highest product is 6,000 puffs. That would equal about 26 packs of cigarettes. So what we're seeing on the market is, everything, but certainly some that are much higher than what has been authorized by the FDA. So we wrote some blog posts looking at these products because we've been asked a lot of questions. Well, what does the Public Health Center think about these? And so back in, I guess that was January 2024, I wrote a blog post about it, and with an optimistic view of the FDA's intentions. At that point, we were looking at some commonalities among those products, and we saw that none were flavored, none were marketed as modified risk, and none of them were single-use disposable vapes. We hoped that this indicated that the FDA was committed to taking a firm stance on against menthol and other flavors, recognizing the health risks of e-cigarettes, and understanding environmental concerns associated with disposable vapes. Unfortunately, we were wrong, and shortly thereafter, they authorized more products. And I had to update the blog in March 2024, looking at some of those, saying that now they've also authorized 4 menthol e-cigarette products, even though we know that the FDA has said that that menthol is dangerous. So we're trying to understand why. And I think that one way of looking at this, and why the timing now is, is it possible that maybe the FDA is thinking about actually banning menthol in cigarettes and views the approval or the authorization of menthol e-cigarettes as a harm reduction strategy? We don't know. Are they, authorizing those in advance of a menthol ban? But they haven't done so yet. And as a reminder, many of you may know that we do have litigation at hand. We do have the AATCLC versus the DAHS continuing to exert pressure on the FDA to fulfill its commitment to ban menthol in all forms of cigarettes and e-cigarettes. How has the FDA responded to these? Well, there's a couple of ways knowing that which products are a priority for FDA enforcement. The first is guidance that the FDA released in January 2020 and then revised again in April 2020, essentially telling manufacturers what they should have known: don't target minors and don't sell products after September 9th, 2020, if you don't have an authorized marketing order. In addition, that document indicated that the FDA intended to enforce against cartridge and pod-based e-cigarettes that come in flavors other than tobacco and menthol. And yet some companies have changed their business practice to try to dodge FDA regulations even more. For example, Puff Bar announced that it would stop using tobacco-derived nicotine. Why is that important? Because previously the FDA could only enforce regulations on tobacco-derived nicotine. However, a new law signed by the president changed this and amended the definition of tobacco product to include products made from tobacco or containing nicotine from any source. So that should close the synthetic nicotine loophole, bringing synthetic nicotine products under FDA's tobacco regulatory authority. But now we are also seeing analog products. We had another question. I'll be presenting at a tobacco retail license ordinance that bans any disposable e-cigarettes or one not authorized by the FDA. At this time, I already kind of answered that in saying that the new authorizations did include some single-use vape authorizations from the FDA, unfortunately. But I do want to also take this time to say that and to be clear that of the 4 newly authorized product, 2 of them are sealed pre-filled pods with menthol flavored nicotine liquid, and the other 2 are disposable e-cigarettes. Once the pre-filled menthol e-liquid is used up, the disposable vapes then can't be reused. And by authorizing those products, we would say that the FDA overlooked environmental concerns associated with those single-use disposable vape products, also because they contain lithium-ion batteries. How many products? Okay, now moving to the state and local action. Many local and state governments have stepped in to regulate flavored tobacco products due to the delays and health concerns instead of waiting for the FDA. The Tobacco Control Acts let states ban tobacco sales, but not regulate product characteristics. The industry often challenges these bans, but to date, all of them have been upheld in a court of law. And most courts support the state's rights to regulate sales, public use, clean air, licensing, zoning, taxing, pricing, distribution, and internet sales within their areas. So that answers this question that, for example, California bans flavors. So what the FDA there does not in any way affect the way that states can go ahead and move forward with eliminating the sale of those flavored products. There's other local and state efforts where the FDA hasn't acted, and some of those jurisdictions, they're really popping up all over the United States. San Francisco and Beverly Hills were some of the first, Manhattan Beach, states like Massachusetts and California have statewide bans, but just in Minnesota, for example, we have over 30 jurisdictions that have prohibitions against the sale of flavored e-cigarettes and tobacco products. So back to the list, because they're wondering about the e-registry bills, let me remind you that relying on a list like this might not be a great idea because it's not very easy to do, but also because the FDA hasn't necessarily been a beacon of light when it comes to progressive action on these products. So where the TCA specifically allows states and municipalities to act in certain areas, there's no reason to tie yourself to the federal government here. And secondly, as a practical matter, the list isn't very accessible. In Minnesota, we had an attorney general send 5,000 letters to tobacco retailers warning them to stop selling deceptive vaping products. And other states like Ohio and Nebraska have had statewide AG impact in that way. This is just an example on the AG's website of reporting the sale of illegal vaping products, where states are able to take action using state law to do that. And I understand this may be a topic of discussion within the National Association of Attorneys General. If you're interested in helping to support such an action in your state, you may want to reach out to your AG. At the Public Health Law Center, we have a list of e-cigarettes, so you can click on the map and see where your state is with e-cigarette regulations. And there it is in the narrative form. And looking ahead, I just want to say that we are still in a period of uncertainty. Partly because the FDA hasn't been a model for safeguarding us on these products. But even when it hasn't used its authority, now we have a Supreme Court of the United States that during the last term did a massive power grab on federal agencies. So even if the FDA were effectively using its authority, now the Supreme Court has set up industry to challenge what they were already doing. The Supreme Court of the United States has granted certiorari on a case where they're coming after civil monetary fines. Where does this leave us? Taken together, these cases also will affect potentially FDA action. And we're at time, so I just want to say that a presentation like this sometimes raises more questions than it answers. And as you can see, the conversation is just getting started. Our profession owes it to the public health community to dig in and also to really explore this idea of harm reduction and what it means for nicotine delivery devices. If it's a topic that interests you, I welcome you to reach out and let us know at the Public Health Law Center. Let's talk about it. What kinds of products are you seeing? How is it affecting the populations you work with? What have you found to be effective, and what are your concerns? I will try to answer all of your questions if you email them to me. There was a lot of great conversation already in the chat. Here's our general contact information at the Public Health Law Center. Also my email in particular. I sit on our federal regulations team here at the Public Health Law Center, led by Esther Abgage, and we have a couple of other great attorneys looking at these questions, and we would be really happy to dive in and continue the conversation with you. That said, thank you very much, and I hope that we can stay in contact.